A lot of patients who are obsessed with their facial appearance. We have a lot of actors, actresses in this area, a lot of news people and television personalities. So when is the best time to start filling the face? Again, one of my pet peeves is the recent appearance of lots of apple cheeks. And again, anything that we do that is obvious, we have failed our patient. So the most natural thing about youth is youth. So it's usually pretty good to leave patients alone in their 20s. We start losing volume in our face from about 25 years on. We lose bone, we lose fat, we lose muscle. Each individual patient is going to age differently, so there are different things that can be done. Probably the earliest that we use, or the area that we use filler the earliest in, are lips. And we have some patients, even in their teens and 20s, that genetically just were born with small lips who want a little improvement there. So when that's done conservatively, it's okay to start at a young age. But again, lips have been abused in the past, and you don't want lips that are walking in the door before the patient. So you have to be very careful with that. And I find almost in some patients, we're able to almost pass the needle in, and just the trauma of the needle creates enough swelling that they're happy with the improvement. In terms of actual facial filling, again, late 20s, early 30s, some patients can benefit from a little bit more volume, and I find that using Sculptra in the proper areas, maybe just a small amount of Sculptra, gives them a little bit of a boost and helps things look better. As patients get into their 30s and towards the 40s, we can use things like Ulthera to create a little bit of lift. When we lift here, there's a little bit more volume in the cheeks. And then from the 40s on, it really depends what is lacking in the patient. But in the 30s and 40s, we love to use a little voluma in this area, because by placing volume here, if you just do a little lift here, particularly if you're looking down, you get improvement under the eyes, you get improvement of the nasolabial folds, you get improvement of some of the wrinkles here, and you even get improvement of the jowl. So again, by knowing the proper area to place a filler, the proper filler to use, and the proper treatment, we can treat patients at all ages. But you want to stay as natural as possible for as long as possible.